Welcome back, everyone. I hope you enjoyed your breakout sessions. So I figured just for sake of pushing us through, because we're almost to the end, it's so exciting. You did it. Those of you who've stuck around, you win whatever the prize is for sticking around. If it's okay with you, we'll just go in order. So I was in group one, and I think Angela is going to present for our group. I just realized that it might be valuable for us to read what our example was. Angela, would you like me to do that since you don't have access to it?
Yes.
Okay, perfect. So example one for our group, the researcher is a genetic researcher who's part of a consortium of 5 research institutions in the US and Europe. The project focus is searching for a genetic component to explain why people assigned one gender at birth so persistently identify as the other, often from very early childhood. Researchers have extracted DNA from the blood samples of 10,000 people, 3,000 of them transgender and the rest non-transgender or cisgender. The project will test about 3 million markers or variations across the genome for all of the samples. So the community engagement studio focus was to get feedback from the community experts on several key factors. One was how to structure a community advisory board and what roles those members should play. 2 was how the study findings should be used and what groups need to be informed. 3, how to disseminate the findings. And lastly, identify and discuss any concerns regarding the project. The community experts for this particular studio were youth who identify as transgender. And I'll turn it over to Angela.
Okay, so the group first started talking about how the Community Advisory Board, or CAB, is vital for recruitment, especially because of this community. And it's not just one community, it can be several sub-communities, and especially with this community, there's lots of misunderstanding. That's a reality of the community. So it's really important to get down to understand this population and what the implications of this study would have on this community. So one area is to identify or realize that there's a diversity of this community. And so the CAB should somehow reflect that. So for example, there's also, different ethnic racial groups, different lived experiences. And so who needs to be invited to the board? So one question, some questions that can be posed about that. And this is also international as well. So some of the structures in terms of like being able to meet or might be difficult. So some of the questions to ask would be, what different types of voices should represent this CAB? Where do we find the voices? How would folks meet? Take time zones into consideration? Are there other creative ways to meet and engage? And this is also acknowledging that this is a complex issue because it's also international. There was also discussion about the labeling of transgender. Another questions that can be posed is whether this is appropriate and whether those communities, how they felt when they were first labeled, or how they feel about the labels, what challenges might come with the labels. And then dissemination modalities. I guess many modalities were mentioned, from like electronic to telephone, but also dissemination would be what would be the most appropriate audiences. And then of course, what format, and then also who should deliver, parents, teachers, those from the community. A couple tips, because this was, we were informed that this was actually an actual engagement studio that where the youth did have a lot of rich discussion. And I think I wrote down here, but I forgot the context. I think from the community engagement studio experience, some of the groups that were mentioned to be disseminated to were law enforcement was one. But correct me if I'm wrong, I have law enforcement in my notes. And then
Yes.
other tips, of course, oh, thanks. Of course, ask open-ended questions. And if it seems like there might be something that might be missing from the discussion, for example, if nobody mentioned social media, that could also be something as a tip. You can always bring it up and say, well, what about this? Was it not discussed because people forgot, or is it not discussed because it's not appropriate? Is anyone else in the group add anything or correct anything? It was a lively discussion, so my fingers were trying to be fast. Thank you.
Thank you so much, Angela. Excellent job. I think what we learned is like some of these studies are super complex and they take a long time to kind of think of like what good questions are going to be for the group. So thank you for presenting. Devin, do you have two?
I almost started talking with my mute button on, but I caught myself. So we're winning here. So yes, so group two, our group was, our case study was about a physician who studies virus transmission. The focus of the project would require individuals to do weekly self-swab, and one blood sample and complete online journaling. And the individuals targeted for participation included essential workers in areas including childcare, transportation, those who would be working working at work during the pandemic. And I'm going to pass it off to Christopher, who will be reading our facilitator's guide.
All right. Hello, everyone. So from the discussion, there were three main topics that presented themselves: participation, logistics, and the reality and buy-in from the community experts. And along the lines of participation, the questions were about what barriers or concerns would there be for participation, specifically around confidentiality in terms of what would be done with the biospecimens and things like that. And then there were also questions about logistics and concerns with logistics. And so how to collect the blood samples, what's a reasonable amount of time for participation in this, this study, compensation, access, things like that were also discussed when it came to logistics and how we could make those things easier. And then finally, the reality and buy-in was, is it actually reasonable to, or is this realistic for this specific group of people to be able to participate in a study like this? And if not, how do we make that possible? And so what types of things do we need to put in place? What resources do we need to offer to make sure that the participants we're looking to include in this study can be a part of the study? And also there was a question about who would they want to hear this information from? And so that kind of ties into the buy-in of who would be trusted individuals in the community that they would feel comfortable getting this information from and would encourage them to participate in the study.
That was great, Christopher. Thank you so much. One of the things that comes out of studios quite often, y'all, is a comprehensive list of trusted individuals, trusted organizations, existing established groups. A lot of times researchers walk away with this like litany of folks that they can now reach out to build relationships and establish themselves as a trusted researcher in the community that they did not know about. We just sent a list to a multi-site clinical trial who it's a researcher who's a career researcher in this area. His response back was, wow, this is great. Thank you so much. We only knew about a handful of these. So if you take some time to do some digging and get some advice, so a lot of these researchers are really, really grateful for even walking away with a list of people and contacts that they really should be doing more work with if that's the research that they're going to be doing. So thank you so much, Christopher. Who's number 3? Anyone?
I'm the facilitator. I mean the scribe and presenter, but
Perfect.
Bree and Jillian. Yeah. Can you read the assignment?
No, so group 3 was myself and Bree as the moderators. So our example 3 is that we had a physician researcher who was studying chronic pain conditions. Their project is to study the effectiveness and ineffectiveness of using opioids to manage chronic pain. Participants will have monthly blood draws, complete daily pain logs, and a final study questionnaire. The study is 6 months in duration, during which they must agree to take specific type and dosage of pain medication only. So for the community engagement studio, they wanted to receive feedback on the thoughts on the study structure, duration, and activities, outreach, messaging, and recruitment, and participation challenges or concerns. The experts in our studio were adults who have taken opiates for management of a diagnosed chronic pain condition for 3 months or longer.
Okay, so we talked about just an opening icebreaker question and the idea of just asking about their story with chronic pain or opiates was way too big and would open up a big old can of worms and way too much time. So we said it's very important to make it very narrow. So if we wanted to ask a question about their experience, do something like, how long have you been on opiates? So the questions we came up with, very generally, what are your initial thoughts about the proposed study? See what everyone says, and then the facilitator might want to dig a little deeper into each of the different points, like how would it work or not work for someone in your situation? What about the length of the project, which was 6 months? What about the idea of monthly blood draws? What about daily pain logs? And what about the questionnaire? Just people's thoughts on each of those requirements. And then the second main question would be, what would you think about participating in a study like this or not? Prompts could be, what challenges or concerns do you have with this proposed study? And then regarding all of the, since the research team wants to know about outreach, messaging, and recruitment strategies, if there are any actual materials, provide those materials to receive feedback, or ask what they would propose. What should the materials look like? How should we do outreach? And then we ran out of time.
That was great though. You guys did a lot of very like pointed, open-ended questions. And Heidi probably already knows this about me because we've worked together a little bit, but my very favorite low-hanging fruit question is always, particularly when I have a group that I think is going to be difficult to kind of open up and get going, is great. I'd love to get us started by going around the room and just getting your initial thoughts about the study, because it's so easy. Everybody can have a thought, right? So once they talk the first time, then hopefully it's easier for them to talk more. And I will say, if you decide to join in on the CES adopters group, we're all also really willing to help with creating facilitation guides, sharing past facilitation guides, because let's be honest, if you're doing a studio where recruitment is the focus, quite often we're going to say, I'd love to go through what you feel like the biggest barriers to recruitment are going to be for this study. And then we list the barriers with solutions. So if Jillian says, I mean, I really think that you're going to have a hard time because this study is only offering appointments like during business hours, and most of the people that you want to recruit are working. They can't get off from work. I'll be like, oh, that's brilliant. How do we address that? What would be a good workaround? And the research team may walk away understanding you're going to have one Saturday a month that you offer appointments, or you're going to have one evening a month that you offer something if you're going to want to get this particular demographic in the door. So that's just an example of a question I use all the time. It's open-ended, it's easy. People give a lot of information when we ask that question. Who's our next group?
That's us, group 4. I'm sorry I have my camera off. My kids are about to return from daycare, and I've heard from my husband they are a disaster right now. So I'm going to do this quickly.
Okay.
So for our researcher is a psychiatric resident who's proposing a collaborative study on mental health supports in the African American community. The project is one that would evaluate the effectiveness of implementing mental health supports via faith congregants made up of predominantly African American members. The project would attempt to collaboratively provide support and complement the faith values of the congregation. So for the studio, they're soliciting feedback from experts on key factors, including barriers and solutions to implementing the project, how to build collaborations and find potential partners, and the perception of mental health in the community. So I believe it was Jacqueline that it was our scribe and
Yes,
Sheila Thacker.
I am the relay person of Group 4, passing on this knowledge and insight to you all. So actually, Tiffany, it was a great segue because someone in our group brought up how much they liked the way you opened up the studio by asking for initial thoughts and impressions of the project. And that is our first question. So we harnessed our inner Tiffanys and wanted to start out with people's initial thoughts and impressions of the project. We also thought it would be really important to ask what, if any, mental health resources are already provided in the congregation. And as maybe a follow-up with more detail, we might want to know of those things that are existing, what's working well and what needs improvement in that domain for mental health resources. Also, what would our experts like to see? What supports are missing coming from the faith community? We also talked a lot about barriers, perhaps acknowledging the hectic and very filled schedules of parishioners and asking how to recruit when we know the schedule's already packed and this is a crazy time for everyone. What are the right incentives and what are the right times? What's our best shot at actually being able to pull this off? We also thought maybe we could ask them about partnerships that they've had in the past that have either gone well or have not gone well, and what did that look like? Some examples of partnerships they may have had in the past. And then there was this idea about the perception of mental health in the community. So touching on, is mental health discussed in the congregation? If so, how is it discussed? And how are you defining mental health? And I think I was note-taking, so I wasn't talking as much, but if I added one thing to that, it would be to bring back in that piece about the faith values. There was an explicit statement of that in the case study. So, you know, what are the values of your faith community and how does that play into things like partnerships, things like mental health and forming collaboration? So it was a really great discussion. And I also think I don't want to leave out the fact that there was a lot of talk about how important it would be to acknowledge kind of the years of researchers and the medical institution really abusing the trust of community members and making sure that the researcher is prepared for that and that they know how clear, how transparent, and how humble they may have to be in this situation.
I think you guys were spot on. I think that those were a lot of the questions that we asked in that studio. And this was
we channeled you.
That's right. That's right. And this was actually, it was a resident fellow for our psychiatric hospital who happens to be Black and is really passionate about mental health in the Black community, but also is very tied to their faith, but was aware of a lot of the stigmas and challenges and thought, you know what, he was there to figure it out. He felt like it would be an obvious collaboration, an obvious partnership that could complement each other. And we had a phenomenal studio. Unexpected benefit of studios, like we talked about earlier. Every faith leader in the room said, when you are ready to apply for funding, we would be interested in collaborating with you. That was really impressive. And they loved him. He was dynamite. So great job, everybody. That was wonderful. And I think we're on our last group.
Yes, I am group 5.
Let's see.
All right, let me pull it up here. Okay, so we had a researcher who was a pediatric physician researcher who was conducting a quality improvement project to improve access to telehealth for diverse patient populations. And the project was seeking input from pediatric patient caregivers on the barriers and challenges of access and communication via telehealth. The goal of the project was to create resources and supports to increase caregiver telehealth usage for appointments that are appropriate. And the community engagement studio was to solicit feedback from community experts on specific challenges and barriers caregivers experience using telehealth, how to improve current telehealth processes, and feedback on video tutorials and materials explaining telehealth processes, including how to log in, creating an account. The community experts were bilingual Latinx mothers of children seen in the pediatric clinic. So we've got Krista from our group who's going to share the group's thoughts.
Sure. So to present, we honed in on 2 questions that are sort of more broad, and they are, can you tell us about a time you used telehealth and what that experience was like? So we thought this could be a good opening question to get the conversation started, have one person start, and we thought, we could call on people if needed, but hopefully it would flow more organically as people started sharing their experiences. We could hear different themes that came up in terms of possibly barriers that were identified in those stories. And then the second question was, what are your recommendations about how we could increase access and awareness about telehealth in your community? And then some of the prompts or things that we thought could be barriers were around internet and technology, language and dialect. This was a bilingual group in a Latinx community, and then just general awareness about telehealth as a resource.
I think that's perfect. Anybody from the group have anything else they wanted to add before I jumped in? So one of the great things about that question that you guys came up with is, even if no one in the group has used telehealth, so they can't tell you about a time they used it, you can easily shift and pivot really quickly and say, well, let's talk about why you haven't. And so I like that you can kind of pivot on questions if people catch you off guard. So that's a really easy question to pivot on. Excellent job. I just wanted everyone to know that these are all actual studios that we've done. These are actual projects with actual folks from the community and patients. And so we tried to pull things that we thought were relevant and real, so that if anybody had questions, we would be happy to give feedback on it. I hope you enjoyed being in breakout rooms with each other. I know it's been a long day. I wish we were in person, maybe another time for a different topic. But that's it for our breakout session. You have a little bit of homework before we close out. Oh, Megan, so cute. We have a little homework before we roll out. We would love for you all to take the notes that you took today during the studio. Just read through your notes, pull out a few things that you think are key recommendations. Don't feel like this is not you qualitatively analyzing anything. Just read through it and be like, you know what, they thought this was important. And then we'll share with you tomorrow. We'll have a little discussion. That'll be a great opportunity for everybody to ask questions, give feedback on the studio. I'm always open to constructive criticism, but we'll just have a discussion about the studio tomorrow, ask each other questions, etc. And you also will get to like pull in folks from like Heidi and Megan and Bree, who've all done studios as well. So we can pull them in as well, and Jillian. So can I turn it over to you, Stephanie?
Yep. All right, guys. So I think Alicia and I can wrap up in about 5 minutes here. It's been a long, long day, but it's been a good day. If I had to use a few adjectives to describe today, I would say informative, enlightening, impactful, collaborative, engaging. I would say powerful. I don't know about others, but I think there were some powerful moments in the demonstration CE studio, and you guys can put your adjectives in the chat if you like. Some themes I saw from today, there was a real appreciation for the value of the CE studio model for getting feedback from stakeholders. From the demonstration studio, I think there was an appreciation for the depth and level of feedback shared by community experts, just looking at some of the feedback in the chat. I think there was clearly an appreciation for the type of skills needed to facilitate the studios, as expertly demonstrated by Tiffany. So now we can all channel our inner Tiffany. That sounds like a hashtag or a t-shirt or something. I got a sense of a ready to implement vibe with the specificity of the questions about the about the studio. So there were questions about how to do this. What do you do here? Those sounds like people who are ready to implement this model. And that's really, really exciting because we want folks to leverage this model in their work. And so now before I turn it over to Alicia, I just wanted to kind of highlight our day 2 and what's on tap for tomorrow. So that's on your screen. There was a lot of feedback on the studio, so we'll get to unpack that a little bit more when we start out tomorrow morning. We'll look at some data tracking and dissemination. You'll get to hear from our panel, so community members and researchers who have been involved in studios, so you can hear from their perspectives. And then we'll have some breakouts in the end to have some facilitated dialogue. So, and then you'll hear from all of us to close out tomorrow. So with that, I'll just turn it over to Alicia for some final housekeeping notes, and I will see you guys tomorrow.
Thank you so much, everybody, for staying on. We know we have folks across many time zones. I think for our colleague that's at University of Cambridge, it's the middle of the night, but thank you for staying on if you're still with us. So for tomorrow, please note we have a different link to join, and that is also in the calendar item that we sent you earlier this week. So there's a different link to join tomorrow. And for those of you who would like to have a breakout room before we start tomorrow, just stay on this call and let us know. We will be as early as 8 a.m. Central Time here, and we can host a breakout room for your teams if you want to have breakfast together. We would normally be doing this in person, so we want to offer that if you need an opportunity before we start tomorrow. And then the other thing is we are going to send out a post-evaluation. Thank you to those that completed our pre-evaluation. And remember that Ed Nappia, who's on this call and a member of our team, has 2 unique pottery pieces he designed that will be put into a drawing for those that complete the post-evaluation. So with that, we wish everyone a wonderful rest of your day. We'll start again tomorrow, 10 a.m. Central. But for those that would like breakout rooms tomorrow morning, just stay on the call. I think we're officially adjourning, although it really feels like we could stay on longer. We've had so much time together despite our virtual environment. So thank you. And where's the virtual clap, celebration, heart, whatever you want to put on for your emoji, please do. And we will stay on a minute for folks who might want breakout rooms tomorrow morning. Thank you, everyone. And thank you to our team.
Yeah, thank you, everybody, for giving us your time today.